Good morning, friends. Today we shall be talking on prostatic enlargement, which is a natural process in elderly individuals after the age of 60 and more often after the age of 55 in Indian population. To know about prostatic enlargement, there are various types of enlargement and various ways to calibrate their enlargement and assess it to no other medical treatment will suffice or any surgical intervention is required at any stage. Prostate is a gland which is located at the bladder neck, urinary bladder neck on the way to urethra, which envelops the bladder neck, and that when enlarged or a part of it projects into the lumen of the bladder, creates an obstruction to the passage of urine or even irritation while trying to hold urine. So there are two types of symptoms which one comes across. One is irritative symptoms. That means you have a frequency of micturition, more so in the night. Second, there will be a drop of urine falling into the urethra, prostatic urethra, which will make it to run to the toilet to pass urine, and there is an inability to hold the urine and part of it falls while you are on the way to toilet. And this can be very embarrassing in public places when you are trying to find a toilet, and that is a very important symptom. Second, one has to wait to pass the urine. That means if you go to the toilet to pass urine, you may not be able to pass it immediately. And you always find that if you attempt to strain to pass urine, then all the more it becomes worse. So you have to wait for the natural process to start the urination. And the stream of the urine becomes narrower, and at times it can, even if you hold it for a long time, it can lead to retention of urine. That means inability to pass urine thereafter, which would require putting in a catheter. Now, how do we normally diagnose? The diagnosis of prostatic enlargement is both by the symptoms the patient gives you, that is the irritative symptoms which I enumerated, as well as the signs of obstruction which is prevalent in these cases. Now, the prostate in our technical language is graded into 4 categories, the grades of prostatic enlargement, and each one warrants a different form of management. Now, the management doesn't depend on the size of the prostate alone, because a very large prostate to the tune of about 80 grams may not produce any obstruction, whereas a normal-sized prostate amounting to 35 grams may lead to severe prostatic symptoms. So, primarily with the history and the digital rectal examination we have required, the doctor asks for an ultrasound examination wherein you have the bladder capacity, the enlarged prostate size, the median lobe enlargement into the bladder, and as well as the urine left behind after you pass, that is called as post-void residue. So all these measures are taken by the ultrasound examination, and making the calculation with the formula, we can find the exact size of the prostate and decide the management strategy. Now, depending on the patient's symptoms, one has to remember that all these patients normally have comorbid conditions like cardiac problems, diabetes, hypertension, and so on and so forth. So, patients who come to you with the prostatic enlargement are usually elderly patients having comorbid conditions, may not be in an excellent physical condition, but all the same, they have to be managed strategically. Now, Coming to a conclusion as to what grade is the prostate, the normal size being up to 18 to 20 grams. Up to 25 grams, we take it as a grade 1, 25 to 75 as grade 2, 75 to 125 as grade 3, and beyond 125, according to the massive enlargement, that is a grade 4 prostate. Now, there are two ways of managing, and you can add up a uroflowmetry test as well, besides the renal function test, and routine other blood tests and urine tests. If you don't tackle this situation in time, it can lead to recurrent urinary infections and stool formation, and gradually can have back pressure effects onto the kidney, leading to kidney damage and chronic kidney failure. Now, the treatment part of it is decided by the doctor based on the ultrasound report, elimination of any suspicious cancer in the prostate, which is done by the serum PSA examination, and of course by a digital examination. And thereafter, one decides, one is a wait and watch, second is a pharmacological manipulation, that means by medicines, and third is by various types of surgical procedures, of which transurethral resection, or TUR, which is the common procedure gold standard, which is still in vogue. The medicines are primarily to reduce the size of the prostate if it is large, and to open up the bladder neck, because selective alpha blockers, these are the drugs which are used for that, and various combinations of alpha-sozin, terazosin, tamsulosin, and cytosine have come into market, along with finasteride or dutasteride, depending on the doctor's choice. All of them have similar actions. One might suit a patient better, and another patient, a different drug may be better. Having given that, the patient has to wait for at least about 3 to 4 weeks to get the result. And it is not a magic step, but as more and more time passes, the patient feels more improved, and a stage would come where the uroflowmetry improves and the obstructive pattern gradually disappears. But one thing to remember, you should not be stopping the medicine when you feel the improvement. It has to be continued for an indefinite time. Besides, the bladder also has several problems in connection with which we call as the overactive bladder. You might require certain medicines to control that, to improve the irritative symptoms of prostate. And well detected in time and given a well trial of medical treatment, failing which undertaking the surgical, which commonly is the TUR, as I mentioned earlier, gives a permanent cure. And I think one should get rid of the problems. And if there is an element of cancer, which is found in 80% of the cases over the age of 80, some focus in the prostate, we have to deal with it in a different way, or the biopsy of the chips which has been sent for histopathological examination. Thank you.